Hello runners, this is David McHenry, physical therapist and the director of the Therapeutic Associates Biomechanics Lab. Today we are looking at the second of the six-part installment of Biomechanical Minutes, and today we're going to be focusing on low back pain. And low back pain can really span across a lot of different categories, so we're just going to talk in general about low back pain as kind of an umbrella diagnosis for any pathology that our runners could be getting in their low back. So we're going to point out 4 biomechanical findings, and we are going to do another bonus 5th finding today as well. So we are going to go into our spine and pelvis view, and we're going to start with the pelvis. So what we're looking at here is we're looking at our runner, and we're looking at the pelvis in 2 planes. We're looking at the pelvis in the frontal plane, and we're looking at the pelvis in the transverse plane. So the first thing that we notice in the frontal plane is that the pelvis is really living in a left side bent position, and it's never really going back into right side bending. So down here we can see that the pelvis is going to a maximum of 10 degrees of a contralateral pelvic drop when the runner loads her right leg, and 0 degrees of a contralateral pelvic drop when she loads the left leg. So let's slow this down and get a better sense of what's happening here. So we are now at about mid stance on the right side. So we'll go to the right side just to confirm that that's where we are. And that's where we are, mid stance on the right side. So when our runner is at mid stance, which is where we're getting peak vertical force attenuation into the ground, we can see that her pelvis is dropping about 10 degrees down to the left. And we can actually visualize that here, where we have the right PSIS and the left PSIS. So this is really a destabilized pelvis, and this could be coming from a multitude of factors, both some core weakness or some muscle weakness or inhibition in the back of this right hip, in the external rotators and the abductors. Nonetheless, the pelvis and the sacrum is really the foundation of the spine. And if the foundation is unstable, then the spine becomes very compromised as well. So this is the first thing that we look at when we have a runner coming in that has some sort of a low back pathology. And this is something that is relatively easy to correct once you find out why it's happening. Okay, the next thing that we're going to look at is the pelvis in the transverse plane. And we can see that we also have an asymmetry here as well in our runner, where the runner is getting up to 8 degrees of a left rotation and 2 degrees of a right rotation. 8 degrees of left rotation is excessive, and we can actually see that here in our motion mapping, where left rotation is represented in a light gray, right rotation in a dark gray. So we can see that things are basically biased into a left rotation. So when we see this, we want to find out when this is happening in her stride so we can figure out why it's happening in her stride. So we're going to go to a peak left rotation, which is happening right about here. So what we're looking at is, this is the pelvis in the transverse plane. 0 would be if the pelvis is totally neutral and kind of facing forward. Everything north of that is right rotation. Everything left of that is left rotation. And we can see that she's living in left rotation throughout the entire study. And here is one of the peak left rotations during this particular stride. So we are in peak left rotation for this particular stride. We're going to go to the left lateral view and find out when that's happening. So she's in mid stance right now, which means that that left rotation is likely starting when she's making initial contact in the front side of her mechanics right about here. We'll go back to the pelvis, and we will see that that is in fact where she starts that left rotation. We can see that the left rotation starts to accelerate right at that moment where she's making initial contact. So the left pelvic rotation is occurring at initial contact on this left side. And there's a lot of reasons why this could be happening. In this particular runner, if we're looking at her tibial orientation, we would like to see the tibia relatively vertical. We don't want to see 10 degrees of a posterior decline position. And we want to see that the knee flexion angle is more than 10 degrees as well. And we'll talk about that a little bit later. But that initial contact is creating this ground impact force, which is driving that left side of the pelvis backwards into left rotation, which is going to put a lot of rotational torque down at the lower lumbar spine. So that is our second finding that we look at in our athletes that have low back pain. Next, we're going to look at the spine, and we're going to look at the spine in the frontal plane. We'll let this play for a little bit. And you will notice kind of visually that as the runner loads right and left leg, they're getting a little bit of a right and a left translation of the torso over the sacrum. We're going to stop this and we'll slow it down. And we'll come back to the left side and we will freeze frame it. And what we are looking at here is we're looking at a variable that this particular system refers to as coronal imbalance, which is a motion in the frontal plane. And it's basically measuring the amount of torso excursion to the left and to the right during left and right loading. So the system has identified the cervicothoracic junction with this red dot. So this is where the neck interfaces with the thoracic spine. The system takes a black plumb line and drops it straight down from there. And then we can look at that vertical line in relationship to the midpoint of the sacrum. So right now, we can see that she has a little bit of a left lateral shift of her torso over the midpoint of her sacrum. If we come up, we can see that it's only 1 degree of left lateral shift. From all of the runners that we've had in our biomechanics lab, we've identified 4 degrees as a high end of normal. So we don't want to see this get more than 5 degrees. So as we come back onto the right side, so she's transitioning into right mid stance, we're going to see that now she's getting about 3 degrees of a right lateral shift. We're going to come back to the left side. And we're going to come back to the right side. And we'll stop here on the left side. So now on the left side, we can see that she is quite a bit further away from the midpoint of the sacrum. If we come up, we can see that she's now in 5 degrees of a left lateral shift. And as I said, 4 degrees is a high end of normal. If we come over here, we can see that over the course of the study, she gets as high as 6 degrees of a right lateral shift, 6 degrees of a left lateral shift. So there's nice symmetry there, but it's excessive motion in the left and the right frontal plane. So the total excursion is about 12 degrees. So this is something that we're starting to see correlates relatively highly with low back pain as well in our runners. Okay, so the last thing that we are going to look at, and then we'll get into our bonus, which we've already touched on a little bit, is when we're looking at the spine and the sagittal plane. We know that the spine and the sagittal plane has a couple of very important roles. The thoracic spine, which is the green section of the entire spinal complex, has a natural forward flexion to it. And because of that, the thoracic spine should work as a really nice vertical leaf spring to help garner some of the impact force from the ground and then return it as we transition from mid-stance into the backside of our mechanics. So how that works is that from initial contact to mid-stance, we're going to get a little bit of a forward flexion bowing of the spine. And that bowing, the potential energy is going to be collected in the viscoelastic properties of the posterior longitudinal ligament and the discs. So that as we go from mid-stance to toe-off, those structures will recoil, the thoracic spine will extend a little bit, and that'll help us get a little bit better push out of the backside of our mechanics. So it's a plyometric structure, it's a spring basically. Lumbar spine works in a little different fashion. So if we go to one of the lateral views, so as the runner transitions from mid-stance, so here we're going to call this mid-stance. So as the runner transitions from mid-stance into the propulsive phase, their hip is extending, so we'll see that her hip starts to extend. As the hip extends, we're going to get a little bit of an anterior pelvic rotation, and that anterior pelvic rotation is going to accentuate the extension angle in the backside of the mechanics. However, as the pelvis anteriorly rotates, that's going to cause an extension in the lower back as well. And this is all very normal, but we don't want it to be excessive. And we've identified what is a normal amount of anterior pelvic tilt in the backside of our mechanics and what is a healthy amount of lumbar extension excursion over the course of the entire study. If we look at our runner, we can see that she is getting about 12 degrees. So this is looking at the flexion extension range of motion of the spine over the course of the entire study. So we'll see that she's going from flexion and extension as she's going from left leg to right leg and going from the propulsive phase into the contact phase. So her entire excursion over the course of the study is 12 degrees, which is pretty good. We've identified 15 as the high end of normal. So her spine is actually functioning pretty well on the sagittal plane. However, if a runner comes in with low back pain and we see more than 15 degrees, then we become very suspicious that that is likely one of the biomechanical drivers of the low back pain. If we look at her pelvis torsion, so the pelvic torsion, looking at anterior and posterior pelvic tilt, she is going from a minimum of 18 degrees up to 26 degrees of an anterior pelvic rotation. That's 8 degrees of excursion. We've identified between 5 to 10 to be kind of the normal range. We don't want to see much more than 10. She's approaching 10, but she's not quite there. So her sagittal plane mechanics look really pretty good. She's not getting excessive extension excursion or excessive anterior pelvic rotation. So in that regard, she looks pretty healthy. Okay, the last thing that we're going to touch on, which we already have touched on a little bit, this is the bonus finding. So if we go to the front side of the mechanics, initial contact on the left side, we will look for the presence of pressure. So here we go, this is the presence of pressure, so we know this is initial contact on the left side. We'll go to the left lateral view, and we'll see that her knee angle at initial contact is 18 degrees. That's pretty good. That's what we like, and we see that her tibia is relatively vertical. That's what we like as well. So if we go back to the right side, and we wait for initial contact. So here we have initial contact, which is the first presence of pressure on the right side. We go to the right lateral view, and we can see that at this point, her knee flexion angle is only 5 degrees. So 5 degrees of a knee flexion angle makes the knee relatively stiff, which means a lot of that vertical impact force in the front side of her mechanics is going to shift through the knee right up into the pelvis and create a lot of force through the lumbopelvic region. We can also see on this right side that her tibia is not nearly vertical. So the tibia is probably more than 10 degrees in a posterior declined position. The knee is really stiff, and all of that vertical impact force is going to go straight up into hip and SI joint and low back. So that's your bonus finding. Less than 10 degrees of knee flexion at initial contact, and a tibia that is more than 10 degrees in a posterior declined position. And we know that this has already been researched by our colleagues at University of Salford. So we have a high degree of confidence that this actually does increase the likelihood of injury, not just in the pelvis and the low back, but through the entire leg. So there you go. That is our second installment looking at low back pain and the biomechanical drivers that might contribute to it. If you're a runner or an athlete and you're curious to get tested, then come into any of our Therapeutic Associates clinics in the Portland metro region, and they will get started on the process of getting you in for a full biomechanical evaluation. Thanks for watching. Give us some comments and join us next Monday for the third installment.